Hi. So we meet again, and this time I want to discuss with you a case which we all know about. Will not name her, but she is a 19-year-old girl who has a weight of 185 kilos. So she's been living with obesity at a very young age and has gone through a lot and not really had an enjoyable experience in her life so far. And I would come to 𝐤𝐸𝐿 immediately. 𝐤𝐸𝐿, when we saw this patient and we were taking her up for bariatric surgery after evaluation, I remember that you said that we will have to start before surgery. So your thoughts on that?
So we started on this patient before surgery. We had a little slight age advantage, I would say, because I thought generally for other patients like it's 5 to 7% of body weight if we can lose before surgery. But for her, I thought even if we could do 2%, it would help, and we did that. So we had an advantage, yes. And after surgery also, we are trying our best, and yes, we are getting results. But for her also, it is very challenging. It's a huge lifestyle change. All her life, she's been eating huge portions and all the wrong foods. So we have to actually take baby steps with her.
So 𝐤𝐸𝐿, are you saying that because of her age, she is a little less capable of adjusting to the new life?
No, not really maybe because of her age, but more so because all her life she's been doing things wrong.
Yeah. So I think you putting her on diet. How much is she complying? Is she complying well enough?
She's complying, I would say 70%. She's trying.
That's good. Right?
That's good.
I think we must congratulate her for complying so much at a tender age. For somebody who is not seeing the bright part of adolescence and youth.
Absolutely.
Right? So 𝐤𝐸𝐿, from your point of view, what was the challenge with her when you saw her?
So her thoughts, her behavior and her actions were not in sync. But it wasn't her fault. She's been overweight all her life. She's been going through so many emotions. There's been so much of emotional turmoil what she's been going through. It's just not her weight. Her weight is something which we are seeing in the outside. But inside, she's gone through body shaming. She's gone through even not being able to do things the way she wanted to do things. Lot of different factors. There's a lot of anxiety. There were things which were uncontrollable for her, and she wanted to control everything. So right now with therapy and with the way she's coming, she needs to lose at least 110 kgs. That's a big number.
Yeah.
But we are sure if she's disciplined, she's going to do that. And we need to empathize with her. We don't need to look at her as a target or something. No. She has her own battles which she's fighting.
I think you properly framed those things, and she has her battles. We think that we are fighting the battle for her, but actually she's fighting the battles almost every day. I remember when we did the bariatric surgery for her, before that, she had so much of nervousness, which required a lot of counseling from all of us to just allay her fears down. The parents were surprisingly in this case more convinced that she needed it, but she was very nervous, and that is understandable.
The one point of therapy, she was so anxious and she was so nervous that she would end up Googling everything.
Yes.
She admitted that, and she knew that she even conceded that she was wrong about it. So she was like Googling everything.
Yeah. But I think what we are trying to say here is that when we see people living with obesity, especially at a younger age group, somebody with enormous body weight such as this, where the weight is 185 kilos, then we are looking at an extraordinary problem. This problem is not only solved by bariatric surgery. We've done bariatric surgery on her. She's lost considerable weight, but still not good enough for her. It's a long journey, but the battles that she has to fight will only be successful if she has the psychologist 𝐤𝐸𝐿 and nutritionist 𝐤𝐸𝐿 to fight along with her. And that is what the message of this 𝐤𝐸𝐿 is, that we are here only to help and support the battle that is primarily being fought by people living with obesity. This reel is for all of you out there who need motivation. Kudos to all of you for fighting small battles in this long journey of battle against obesity. Thank you very much.
Thank you.